Now I'll perform the advanced sensory exam of the lower extremities, starting first with superficial touch and then superficial pain, and then we'll move to vibratory sense and joint position sense. Now for superficial touch, just as with the upper extremities, we want to know whether Mary can feel me touch and whether both sides are equal and test each one of the dermatomes. So Mary, I'm going to have you close your eyes in a moment, and then I'll touch you in one spot, and you tell me whether you feel that, and then I'll touch you in a same spot on the other leg and tell me whether that feels the same.
Okay.
Okay? And so I'll talk about each one of the dermatomes as we're testing them.
Yes. Same.
All right, so that was the L2 dermatome. Now I'll move to L3.
Yes. Same.
And then to L4.
Yes. Same.
And L4 is checking on the medial ankle, and L3 was on the medial knee. Now I'll move to L5 on the lateral foot.
Yes. Same.
And S1 on the outside of the heel.
Yes. Same.
Okay. Now after checking superficial touch, I'll check superficial pain using the same technique, but I'll tell Mary a bit about what this is. Now Mary, I broke off the end of a cotton-tipped applicator, and I'm going to touch you on the leg here. I'm going to check that sensation, the ability to tell that. So I'll touch you in a place and you tell me whether you feel it, and then on the other leg, tell me whether it feels the same. And
Okay.
yes, you can close your eyes for this. All right, so L2.
Yes. Yeah. Same.
All right, so that was on the upper leg, and then inside of the knee, L3.
Yes. Same.
All right, good. And then on the medial ankle, this is L4.
Yes. Same.
And okay, that's L4, top of the medial ankle. L5 is top of the foot.
Yes. Same.
And S1 is lateral heel.
Yes. Same.
All right, so that's the superficial pain sensation that I touched Mary in each of those locations. The next part of this is the vibratory exam. And just like with the upper extremities, I only have to check on one toe on each side, and if that's normal, then I can assume the rest of the toes are normal as well. So I'll start with using the tuning fork, tap it on my palm, and I'll ask Mary now, Mary, close your eyes and tell me what this feels like on your toe.
Vibration.
All right, and I have my finger located under her toe because I can feel vibration through her toe and into my finger, so I know there still is some vibratory sense present there, or vibration present. And I can ask Mary, now Mary, you feel vibration?
Yes.
And then tell me when it stops.
Stop.
Okay, so I've checked vibratory sense and her ability to sense when it stops as well. Now I'll do the same thing on the right side, and Mary, keep your eyes closed. And I'll touch on the distal edge of the toe here, just behind the toenail. And Mary, what does this feel like?
Vibration.
All right, and tell me when it stops.
Stop.
All right, so she notices when it stops as well, so vibratory sense is intact. I'll check joint position sense, and Mary, you can look at your toe here. What I'm going to do is I'm going to move your toe either up or down,
Okay.
and I'm going to be much more subtle with that than what you noticed there. But if you can close your eyes,
Okay.
and then tell me whether I'm moving the toe up or down.
Down. Up.
And notice I have my fingers just on the outside of the toe. I don't want to apply pressure like this because Mary would be able to tell there's pressure of movement up and down. Instead, I'm moving the toe away a little bit and moving it up or down this way. Now I'll check on the other side. And close your eyes again, and then tell me whether you feel me move it up or down.
Down. Down.
Okay, and so joint position sense is intact on both sides.